So a group of 10 countries participating in the global COVID-19 therapy trial, they've agreed a comprehensive analysis is needed, critical appraisal of this hydroxychloroquine evidence and other data necessary, hence suspending the trials. Joining us in the studio is Dr. Onedo Titilayo. She's a pharmacist at the National Orthopedic Hospital, Igbobi, Lagos. Thank you for joining us.
Thank you. I'm glad to be here.
Now, we heard about the temporary suspension by the WHO, the trial of hydroxychloroquine, and this is over safety concerns. Are you worried that this is a period where the whole world is scrambling for a solution, for a vaccine, and then what many people have touted as something that works, even the US president, and then we're seeing the World Health Body putting a suspension, a temporary pause on the search?
Thank you. On one hand, I am worried. On the other hand, I think it is better to err on the side of caution. And I think that is what WHO has done by putting a temporary stop to the trial of hydroxychloroquine arm in the Solidarity trial. Having said that, I would want to say that the trial, the temporary halt in the trial came as a result of the findings from Lancet, where it was reported that a whole lot of people using hydroxychloroquine died. And as a pharmacist, I know that disease condition actually has a way that it affects disposition of drugs. And I think this is what is playing out here, COVID-19 being very new and not so much is known about it. I think it's the disease condition that is having its own toll.
What do you mean by that when you say disease condition?
Okay, COVID-19 now.
Okay.
Every disease, like chloroquine itself has been used for so long in autoimmune diseases and even in the treatment of malaria. And even it's been reported that it has antiviral activities. It's been reported that it even has antiviral activity against SARS-CoV-1. And I think with that information, that knowledge, that's what made people to be so confident of trying to use it in COVID-19. COVID-19 is SARS-CoV-2. So with what is happening now, I think what would happen is, because the trial has actually begun and a whole lot of data has been collected, and what I know, that there are times that you may have conflicting reports from observational study, which Lancet reported, and the WHO trial is actually a randomized clinical trial of hydroxychloroquine. There are times that you have, what is it called now, conflicting report. But with the data that the WHO has collected so far, I think the data should be evaluated to actually see if their own randomized clinical control trial would report the same findings.
Still talking about it, we understand that the Lagos Commissioner at a point mentioned the clinical trial also for hydroxychloroquine in Lagos. Do you think it should still proceed with this position from WHO on the other hand?
I wouldn't. I think it should still proceed. And the reason being that you have to look at the clinical, the design of the clinical trials now. I'm not so aware of the design. We have to look at it, you compare it with the WHO trial and see. We have to look at the doses that the Lagos State trial is being used. You have to look at the pharmacovigilance reporting system that has been put in place by the Lagos trial. And I would want to say that at this point in time, with what is happening, with what has happened with the Lancet report and the temporary suspension of the WHO trial, the Lagos State trial, if really they have not put in place a pharmacovigilance reporting system, I think this is high time that is put in place.
We heard the Lagos option is the double-blind trial.
Yes, it is a double-blind trial, but then you need active pharmacovigilance reporting, because active pharmacovigilance reporting by clinical pharmacists, that should be stressed, you need clinical pharmacists to be involved in this trial. And if you put that active pharmacovigilance reporting system in place, it will help in early detection and prevention of any drug-related problem.
So moving ahead now, in terms of treatment, Nigeria is still witnessing more cases as well as other countries. How do doctors, handle the cases in terms of treatment?
Okay. The hydroxychloroquine trial, is just one arm of the Solidarity clinical trial. You still have 4 other drugs that are still being subjected to this randomized clinical trial. And just recently, Redensivir, that was actually positioned initially for Ebola, has actually shown some promising results from the trial, and it's been recommended to be used in the severe COVID-19 cases where oxygen supplementation is actually needed. And you still have some other drugs that are being used, but we should know that right now there is no cure for COVID-19. So all we are doing is like empirical treatment, but at the same time, we should not actually shy away from the herbal preparation.
Option.
So we should look inward. We should look at what we can do. And for the vaccines, it takes time for vaccines to actually be come into clinical use, because you have to think about all the stages involved in the clinical trials from stage 1 to stage 4, and we have to be very careful with the use of vaccines. So I know Pfizer has started some clinical trials of some vaccines, and even WHO, there's Solidarity clinical trials of vaccine. So I know Nigeria has actually signified interest, but the information that I have is that NAFDAC said no one has actually approached her for approval for vaccine trial. I think researchers should actually key into this vaccine research trial in Nigeria so that they will be able to play a significant role in the fight against this COVID-19 war.
All right. We'd like to thank you, Dr. Nedo Titilayo, a pharmacist with the National Orthopedic Hospital, Igbobi, Lagos. Thank you for joining us on the program.
You're most welcome.
We'll have more on the COVID-19 updates when we return. Join us again.